So where do we stand relative to insurance? The estimates vary. The most widely accepted is that there are approximately 45 million currently uninsured. I've heard that as high as 50 million. But if you look at the population that does not qualify for Medicare, those under 65, 1 in 3 individuals does not have insurance. And the problems that result from this lack of access to insurance is that routine care is often not provided. We all know that prevention may cost money up front, saves money in the long run. The earlier people get into the system and deal with chronic problems before they become serious, the better we're going to do in the long term. And ultimately, the better they're going to do health-wise, and the better we're going to do in terms of the cost of care. Those folks who are uninsured still consume a considerable amount of health care. In the last couple of years, the estimates are that we've spent $116 billion on providing care to the uninsured. 37% of that comes out of the pockets of the uninsured. 26% comes out of governmental programs that are set up and charitable programs that are set up to pick up some of the costs of these kinds of programs. But the other 37%, about $43 billion, is absorbed by the providers of health care. And I think you'll hear from some of our panelists what happens because they're absorbing the cost of providing care to the uninsured. Ultimately, what happens is that costs are shifted. And from the standpoint of their being shifted, insurance premiums are going up because as hospitals, physicians, dentists, whoever, are having to absorb uncompensated care, they've got to raise the price to the people who can actually pay for care to underwrite the cost of the free care that they're giving. So what we're seeing as a result is that insurance premiums are going up for families, about $1,000 per year is the latest statistic, and that for an individual it's about $370 per year of higher cost. So who are the uninsured? I think we can burst the bubble here by telling you that 69% of the uninsured have at least one family member who is working full-time. We're not talking about people who aren't working. We're talking about the bulk of the population. Only 19% of the uninsured are folks who are not working, which means unemployed, retired, whatever. In terms of age, 20% of our kids, ages from birth to 18, do not have insurance. Young adults, 29%, from 19 to 29. The middle years, 30 to 44, 27% of those people do not have insurance. And from 45 to 64, 24% do not have insurance. So why is it that people aren't insured? Obviously, it's the cost of health insurance. A lot of people lose insurance when they either lose a job or change employment. A lot of people lose their insurance, particularly in this state, when they no longer qualify for Medicaid. And ultimately, there are a lot of folks who are ineligible for insurance because of their age or because they've left school, whatever. It's a very serious problem in this country, and one that I hope we're going to be able to resolve shortly.